Okay, so good evening and welcome. Thank you guys for coming out tonight and taking the time to invest in your health and your wellness by being here tonight to learn about headaches. So, what people don't understand is that people don't know what they don't know when it comes to health. And how are we supposed to run this marathon called life if we don't understand how the body works? There's a direct cause and effect relationship that occurs in the body. People don't just get their normal headaches. Like, what is a normal headache? Is such a thing exists? Like, no. Are headaches normal? No. Are they common? Yes. But that doesn't mean that it's normal. So tonight we're going to be talking about the different causes and effect relationships when it comes to your body and your health and headaches itself. And there's different types of headaches that I develop or see in my practice that we're going to be going over. So for those of you that don't know me, my name is Dr. Keith Giaquinto. I specialize in internal health. So I deal with the mechanical or musculoskeletal aspect of the body, but I also deal with the internal or the metabolic issues with the body as well, and take much more of a holistic approach when it comes to treating my patients and helping them to heal themselves. So tonight, we're going to be talking about headaches. So by the time you guys leave here tonight, you're all going to become experts in headaches and what causes them and how to fix it. Okay? So tonight's agenda, we're looking at the big picture of health, the different causes of headaches, the main concepts of natural healing, but more importantly, as we were talking about earlier, is that how many people you know out there that have headaches that should be here tonight, right? So I want you guys to be able to share this information with your loved ones, your family, your friends, your neighbors, your coworkers who have headaches that don't know that there's another reason or another way that they can get rid of them without using drugs and medicine, okay? So keep this conversation going outside this room here tonight. Now, there's an equation of how the body gets healthy, because health is an expression of the body, just like disease is. And there is this something called innate intelligence. How many of you guys have heard of innate intelligence before? Yeah, so one person. Okay. So innate intelligence is a constant, and we're going to go over that in a little bit. But you times that by function at 100%, which is your variable, and guess what happens? The body expresses health. So what causes the body to become dysfunctional? And when the body becomes dysfunctional, guess what? It expresses it through disease or symptoms. And what is that functionality in the body? Well, that has to do with homeostasis. So we're going to go over what innate intelligence is and homeostasis is in a few slides here. So just bear with me. But this is kind of like the equation of how the body works. So, innate intelligence. All living matter has this thing called innate intelligence. It's in every single cell, it's in every plant, it's in every animal. It's what animates the living world. This innate is the force that is responsible for the organization, the maintenance, and the healing of the body. It is constructive, adaptive power for survival, and it is expressed through the nervous system. Present in every cell, and every cell is programmed for well-being. Let me let that sink in for a moment. Our natural state is health and well-being. So if this is true, then why is there so much sickness out there? Well, that's what we're going to go over here tonight. I mean, imagine a wisdom that is so great that it knows more in 1 second than we could ever consciously know in our entire lifetime. This is the work of innate intelligence. When my patients come in to see me, I do not heal them. They heal themselves, and it is done through innate intelligence. Now, what is an example of innate intelligence at work? Well, look at how a baby is born, right? The moment of conception, you've got one cell that then in 9 months turns into 50 trillion cells that is specialized and organized and differentiated into something that we call a baby. How does that happen without conscious thought? That's the work of innate intelligence. When we scratch our arm, right, it starts to bleed. Do you sit there and think, okay, now bleed, now scab over, now start to heal, and now the scab fall off, and the skin go back and be smooth and healthy? Like, no, you don't have to do it. It just does it automatically. You don't have to think about taking your next breath or having your heart beat. This is the work of innate intelligence. Now, the thing about innate intelligence is that innate intelligence is the executor. It executes. So who is its boss? The brain and what you think. Exactly. I tell my patients all the time, your biggest asset or your biggest liability in you and healing is going to be the 6 inches between your ears. What you think and what you believe will have a direct impact on innate intelligence and whether or not you heal. Example of that, right? Do you know people who are worrywarts? What's their health like? Yeah, it's always questionable. Exactly. So, you guys understand innate intelligence? Okay. Now, homeostasis. Homeostasis is the body's ability to maintain the consistency of its internal environment despite changes in its surroundings. The thing with homeostasis is that it forces relationships without exception. There are 11 organ systems that run homeostasis, and all 11 organ systems are totally dependent upon the right nutrition and proper communication with the brain. That's weird. Okay. So when you have more bills than money at the end of the month, who do you pay first? Yeah, exactly. The one who's going to come break your legs. The one that's going to hurt you the most. And this is how the brain sees the body. Okay? Let me give an example. Have you ever gotten sick, like got the flu or something, and you lost your appetite? Right? It's fairly common. Why does that happen? You know?
It's just your body trying to feel like when you're fasting.
Yeah, exactly. You're absolutely right. Because it takes your body an enormous amount of energy to run the digestion system, right? It's metabolically expensive. Well, guess what? So is the immune system. So if something is literally trying to kill you, your brain's like, yeah, digestion, we're not even going to worry about that right now. That's like low on our totem pole, but we got to focus on the immune system. And then once your body gets strong enough and your immune system gets a handle on it, then what happens? Your appetite comes back, right? That is what I'm talking about with forcing relationships. Another example is, you go out and start going for a run. What has to happen? Well, when you start to run, your heart has to pound faster. You got to breathe heavier, right? Your body, again, is not going to be worried about your digestion system. So it forces relationships without exception. And it's no different when we have different health issues or symptoms or problems. So these are the 11 organ systems that maintain homeostasis, right? One of them is the lymphatic system. Do you guys know what the lymphatic system does? Does what? Not necessarily clearing them, but that's where the toxins go, right? So the lymphatic system is kind of the sewer system of the body. All of the metabolic toxins and waste and debris get kind of put into the lymphatic system, which then has to get dumped back into the blood and then excreted out through the kidneys or the lungs. So, because the lymphatic system is going to play an important part with the headaches. That's why I wanted to mention that. All right. My wife keeps complaining about having a headache that won't go away. I tell her I have a name. Some stats about headaches. There's more than 150 types of headaches, 35 million people with migraines, and 20% of children that are prone to headaches, 15% tension, 5% migraines. So that's a lot of people. So the common headaches that I see in my practice, there's only 5 of them. How they're coming up with 150, I kind of beg to question that, but whatever. I see about 5 different headaches in my practice. Obviously, migraines, they're the most severe. I see tension headaches. I see sinus headaches or facial headaches. Then I get period or hormonal headaches. And then this last one I kind of came up with on my own, and I call them toxic headaches. It's like you just get this headache, but there's no alcohol that's involved. And this is more like emotional and diet related stuff. And we're going to go over these in greater detail later. But these are the 5 most common headaches that I see in my practice. So how do most people relieve headaches? What's the first thing they do? Drugs. Lay down. Okay. Medication. Exactly. They're called NSAIDs, right? Non-steroidal anti-inflammatories. And these are just examples of them, right? Aspirin, ibuprofen, Motrin, Advil, naproxen, Celebrex. So what's the first thing people should do when they get a headache? Rest. And what else? Water. Yes. A lot of times headaches are a sign of dehydration. So going and getting a glass or 2 of water and drinking it, that might be enough to relieve the headache. But people don't do that, do they? Yeah, exactly. When I get a headache, I take 2 aspirin and keep away from children, just like it says on the bottle. All right, do you guys know there's side effects with taking NSAIDs long term? Do you know what those side effects are? That's part of it, yeah. So long term, according to the Cleveland Clinic here, is more than 10 days consecutively for pain. Higher doses than recommended when people take more than what's recommended on the bottle. So stomach, right? Gas, bloating, heartburn, stomach pain, nausea, vomiting, diarrhea, constipation, and bleeding ulcers. Cardiovascular events, heart attack or stroke. Dizziness, balance problems. Allergic reactions, swelling in the mouth, face, lips, and itching. These are common side effects of overdosing on or taking non-steroidals long term. So here's a study that I found that was kind of interesting. And in this study, what it says is that data from multiple placebo-controlled trials and meta-analysis studies alarmingly signify the adverse effects of NSAIDs in gastrointestinal, cardiovascular, hepatic or liver, renal, kidney, cerebral, brain, and pulmonary complications. The present review provides a comprehensive insight of the existing knowledge and recent developments on NSAIDs induced organ damage. That sounds like fun, doesn't it? Who wants to damage their organs by taking some aspirin? NSAIDs are associated with 30% hospital admissions for preventable adverse drug reactions. 30%. That's a lot. Another study here shows that chronic users of NSAIDs have an increased risk of bleeding and visible damage to their small intestine. Each year, the side effects of long-term NSAIDs use cause nearly 103,000 hospitalizations and 16,500 deaths. That's a lot. Let's kind of put that in perspective a little bit. So 16,500. Let's say that your average 747 holds about 500 people. So to get to 6,500 deaths, or to that number, You got to have 2.75 plane crashes every month, all year long, every single month. Could you imagine if we had 2 plane crashes in a month? They'd shut the airplanes down, right? They would land everything. But yet this goes on so casually and nonchalantly with, NSAID use that people are like, oh, let's just normalize it and make it. So I'm going to throw this out there. What causes headaches? What do you think? Nervousness, tension, okay. Anxiety, okay, good. I like where you're going with that. Yep, exactly. From an acupuncture perspective, stagnation, exactly. Hormonal, yeah, sure, absolutely. So people want, well, what's the one cause? Because if there's one cause, then I can do one thing to fix it, right? Well, there's not just one cause. There's many contributing factors to it. So what causes dysfunction? That first slide I talked about, innate intelligence and 100% function equals health. So what causes dysfunction in the body? You ever hear this word? Stress, right? Everybody knows what stress is. So let's kind of define stress. Dr. Hans Selye was a medical doctor, and this guy had a brain on him. He earned 3 doctorates. Your medical doctor, your PhD, and then a doctor of science. He spent 50 plus years studying stress and researching its effects on the body. He wrote over 1,700 scholarly papers and 39 books about stress. He's known as the father of stress, and he was actually nominated about, I think, 17 times for the Nobel Peace Prize. So I think he's kind of an expert in this. What does he have to say about stress? Well, his conclusion is that stress is a specific entity, and it's the non-specific response to any demand that is placed upon the body. That's what he defines stress as. What he comes to the conclusion in is that there's only 3 sources that we have to fight when it comes to stress, and that is mechanical, emotional, and nutritional. So stress is the cause of all disease, and men are the cause of all stress. So let's kind of dive into this a little bit. Mechanical stress, emotional stress, and nutritional stress. What are we talking about, like with mechanical stress? Well, we're talking about subluxations in the spine. We're talking about poor posture. We're also talking about TMJ issues, people that have jaw issues. Can all cause headaches. Emotional stress, right? Relationship issues, money issues, worry, excessive mental activity. We're going to touch more on that in a little bit later too, but just life in general, right? Sometimes life throws curveballs at you and you just got to roll with it, And then nutritional has to do with your diet and what's on the end of your fork, but also your body's ability to digest and absorb the nutrients from what you're actually eating. Because just because you put something in your mouth and you swallow it does not mean that your body digests it, does not mean that your body absorbs it, or the nutrients actually get to the cells and the tissues and the organs for them to do their job. So many times I have patients come in to me that exercise very regularly, they eat clean, but yet they still have all these health issues. It's not a question of their diet and their lifestyle, it's a question of, well, how is your body functioning? Or shall I say, not functioning? Because if your body was functioning well, it would be expressing health. So that's kind of where my expertise comes in, is looking at where is the dysfunction. So subluxations. Subluxations are a chiropractic term that means that there's a misalignment in the spine that causes nerve interference. Now we've got 24 vertebrae from our head to our pelvis, and each vertebrae needs to move independently of the one above and below it. Now there's a nerve that comes out from every single level. Each nerve goes to three things. It goes to an area of the skin, it goes to an organ system, and it goes to a muscle group. So when you have subluxations in your spine, it can cause the muscles to contract or weakness. It can cause organs to become dysfunctional. And that's where numbness and tingling and things on the skin can come into play, or radiation of pain. So that's what we're talking about with subluxations. And you can have many of them in your spine. But when it talking about headaches, we're looking at this suboccipital region, right here at the base of your skull. And this is a good picture of that. All of these muscles here collectively are called your suboccipital muscles. So what happens is that when you've got contraction or one or several of them, it can cause your head to tilt. And how you know you have a subluxation at the base of your skull is you look in the mirror and you look at your ears. Are your ears level or are they tilted? Now, you may not have pain, but you will have muscle contraction up into there, especially if you do suffer from headaches. So the nerves that come out from the upper cervical spine, right, C1, C2, C3, they go up into the head. They innervate the ears, the eyes, the jaw, the sinuses, face, top of the head, and back of the head. So when you have that tightness up and through there, and you have those subluxations, a lot of times it refers that pain up into the head and can actually cause that headache. Anatomical, physiological, and clinical evidence exists which indicates that disorders in the structure of the spine are a frequent cause of headaches. Over 70% of all headaches arise from the problems with the cervical spine and its related structures. We're closing in on the cause of your headaches. You remember those things? Weren't those fun? Gotta throw a little humor in there. All right, posture is another form of mechanical stress to the. So if you have your head that is way out here, if you've got your shoulders that are rounded, what happens to all these muscles up and through here, right? They become tight over time. So if you understand how posture works and you learn how to stack your spine by pulling your shoulders back and down, bring your head back over your shoulders, and use that thing in the middle of your body called your spine, that is so much stronger than all of the muscles up and through here. Because what people don't realize is the muscles in your neck, they're made for navigation, right? Moving the head around, looking around. They weren't made for weight bearing. So the more forward your head is, the more fatigued these muscles get quickly, and they become more weight-bearing muscles, and they weren't designed for that. So they're going to contract and cause lots of issues in the upper cervical spine. Good posture improves your overall health and appearance. Poor posture, on the other hand, promotes back pain and can affect your position and function of your abdominal organs, inhibits breathing, oxygen intake, and cause headaches. It may also affect your mood. Imagine that. TMJ issues. Here's a picture of referred pain. So when your jaw is tight, it's directly connected to the upper cervical spine. So when you've got tightness here and you've got tightness here, it refers pain up into the head and can be a source of your headaches. There's a lot of I see patients with TMJ stuff all the time, and there's internal mouth work that I do to help loosen up those muscles. And they're like, oh my gosh, like, wow, like my jaw feels so much different. So then what's the other thing? We're talking about mechanical, emotional, nutritional. Why would people have TMJ issues? Let's look at this from a different perspective. How about like emotionally? Yeah. Well, what is your mouth from an emotional perspective, what is that related to? Absolutely, yeah. It's your voice, right? You got to get whatever's in you out. And if you are not dealing with things on a conscious level and confrontation or life or whatever, then you stuff that down subconsciously and your jaw just becomes tight. So if you're able to give voice to that stuff and get it out of you, it can make a big difference. So again, headaches, the suboccipital muscles and subluxations up in there refer pain to the head. But here's the other thing too, is that when you've got subluxations up here, it weakens your digestion system. And I'll show you a little bit later when we get to the nutritional part how that is connected. So moving on to the emotional stuff. Anybody here not have emotional stress? What's your secret? So we have relationship issues, right? Whether it's a family member, spouse, sibling, neighbor, coworker, boss, right? Our relationships with other people, but also your relationship with you. How kind are you to you? Do you take care of yourself? If we had a friend that talked to us the way that we talk to ourselves sometimes, that person be our friend anymore? Yeah, probably not, So why do we think it's okay for us to, we all have that inner critic, but it's learning how to tame that and not listen to it. So relationships are a big part of that. Money struggles, worry, anxiety, depression, excessive mental activity. So let's talk about that, excessive mental activity. What are we talking about with that? Well, there's lots of different things. But critical analysis, if you work in a job where you got to take a lot of data and information and do a lot of critical analysis like all day, every day, all day long, right? You're going to get mentally fatigued. And that's going to play out in your physical body, okay? So that's where your diet and your nutrition, your hydration, exercise, and taking frequent breaks and stuff in there can kind of help to get you sustained in that environment. So doing that critical analysis. Overthinking, then we already kind of touched on that, but like people that just worry or are living in fear, right? They don't have that trust, and that's not a good place to live. Worry doesn't help anybody, but it robs us of the present moment because your mind is always in the future with that. And if you guys are into reading and stuff like that, Eckhart Tolle wrote a book called The Power of Now that goes over this. And like that book changed my life, right? He's talking about with the whole anxiety, depression aspect of it is like all we have is right now. So when you are fear-based, when you're worried, when you have anxiety, your mind is always in the future. But if you're bitter or angry or depressed, your mind is always in the past. So we don't realize how much energy we are expending and wasting by being anywhere but 100% present. And you can tell those people that aren't present, like trying to have a conversation with them, and you can just tell their brain is everywhere. Like they're just so scattered. Fear. The fear of losing something good or the fear of gaining something bad. I think it's just kind of human nature that the unknown is kind of gives us a level of fear, but it's learning how to trust that no matter what happens, that you'll be okay, and surrendering to the process and not trying to control the outcome of things. I tell my daughter all the time, we only have control over 3 things: what you think, what we say, and what we do. We have no control over anybody else. We have no control over the outcome. Things are going to unfold exactly how they're supposed to unfold, and you have no control over that. So why stress ourselves out over something like that if you surrender to the process and just enjoy the ride, changing your perspective like that can really make a huge difference. All right, nutritionally, what we put into our body really does make a difference. And people that eat stuff like this consistently all the time is going to have headaches and digestion issues. What's the thumbs up for? I know it tastes good, right? But a lot of this stuff is not very nutritious, and it causes inflammation, and it causes our body to become toxic. So poor diet, high in refined carbohydrates, like everything on this picture, or I like to call it sugar, because you've got two different types of carbohydrates. You got your ultra-processed carbs, which is all of this stuff, and then you've got your complex carbs, which are your fruits and your vegetables. You want to eat more fruits and vegetables and minimize the amount of stuff on here that you're taking. Now, I'm not saying you have to be perfect and eat 100%. Hey, I enjoy pizza. Pizza's really good, you know. I definitely enjoy a burger every now and again. Or ice cream. Ice cream is definitely my weakness. And, whiskey's pretty good too. So, but I don't eat that like every day or every week. I only go and eat that a little bit. So 80% of the time, if you're eating clean, you can enjoy that other 20%. It's not about being perfect. It's about making progress. So diet and what is on the end of your fork is important, but it comes back to the digestion component. Do you have weak digestion? Because a lot of times what I find with people that have headaches is that their mucosal lining in their stomach is compromised and irritated because of a lot of the emotional stress that they're under and the crap diet that they eat. And that leads to enzyme deficiencies, which then weakens the digestion system. So people may not know, but we have our spine here, and it's not just in our back, but our spine actually talks to all of our organs in our body. And when we're talking about subluxations up here at the base of your skull, we have this vagus nerve that comes down from the brainstem, and it innervates the heart, it innervates the lungs, it innervates the stomach, the liver, the gallbladder, the pancreas, the adrenals, all the way up into the first half of the intestines. So when you've got a subluxation up here at the base of your skull, it mutes that nerve and it decreases that vagal tone to the gut, and bad things are going to happen that weaken digestion. What kinds of things weaken digestion with that subluxation? Well, what happens is that you decrease hydrochloric acid production, which is necessary to activate enzymes to digest your food. It decreases enzyme secretion. It decreases bile flow, gut motility, right? Can make people more constipated, and also decreases blood flow to the gut. So when you have that decreased tone from a mechanical cause up here at the base of your skull, it weakens your digestion system. Now, when you have weak digestion, what then happens in the body? What else occurs? Well, I'm so glad you asked. Weak digestion leads to leaky gut syndrome, where you've got inflammation now in your intestines and big pieces of undigested food and toxins that normally cannot get into the body because of that inflammatory process. There's holes in your small intestine that these bigger pieces can now get into your system. And when these bigger pieces of food and toxins get into your system, what are your cells and your organs going to do with that? Right, attack it, exactly. And what system does that? The immune system, right? Because these bigger pieces of undigested food and toxins, your organs and cells and tissue can't do anything with it. It's too big. They need smaller pieces. So who has to clean up that mess? Your immune system. And is it by chance that 70% of our immune system is located in our gut? Yeah, no, not at all. So we have this leaky gut syndrome that occurs. It can lead to bowel toxicity, right? This is where constipation, diarrhea, and stuff can occur. And when your bowel becomes toxic, where all those toxins go? Well, they have to be reabsorbed by the body, and it gets into your body and into the lymphatic system. Who has to clean up the internal environment? Right? Everything that happens in the gut, where does it go first? It gets shot into the liver. The liver is a big filter. It has to detoxify and break all that crap down before it gets into the general circulation. And then the kidneys. What's the function of the kidneys? To filter out the blood and excrete the toxins out through the urine. So your liver and your kidneys are two main filters in the body. And then the immune system has to make up for everything that's in between. And when your lymphatic system gets congested, this is when you can have problems in the body. So let's look at it this way. There's different ways that you can know if you've got lymphatic congestion. If you find your elbow bone and use your pads of your finger and just come north of that a little bit, right under the bicep. If you rub in there firmly, if that feels tender to you, you've got lymphatic congestion in the upper extremity. Same thing in the lower part, just below the knee, behind the tibia, right in through here. If that's tender in there, you've got lower extremity lymphatic congestion. Now, how long would you be able to live in your house if you had 18 inches of sewage on your first floor? Yeah, not long at all, right? It's disgusting. Well, that's what happens in the body when you've got lymphatic congestion. Those toxins are not supposed to be there. So when your liver and your kidneys can't filter that out and break that stuff down, then you've got this congestion that starts to occur. And it just circulates around and around and around in the body. Okay? It kind of looks like, things get clogged up. We don't want that. That's bad. So this is what I want you guys to really kind of understand, is that there is a cause and effect relationship that occurs in the body. Health problems don't just happen out of sheer randomness. Something has to occur in order for something else to occur, for something else, and there's a whole cascade of events. So there's that first domino that falls over that leads down to like the 10th, 11th, 12th, 13th domino. So the 12th and the 13th domino are your symptoms and your health issue. But what causes the first domino to tip over? Because when you're chasing symptoms around the body with medication and you're only dealing with the 12th and the 13th domino, no healing actually takes place because you're missing 1 through 11. And if you don't get to that first domino, you're never going to heal. Management is the best thing that you can do. So your brain doesn't care what form of stress your body is under. Your brain and your body are going to fight stress the exact same way every single time. And what happens? How does the body combat stress? Well, the first thing it does is it requires more nutrition. So when you are under stress, when you have high stress, or you've got moderate stress that is prolonged, your body can require up to 4 times the amount of nutrition. So can you imagine eating 4 breakfasts, 4 lunches, and 4 dinners simply, not because it's fun, simply to keep your head above water? You know what I mean? Like, we just can't do that. We'll be eating all day long. So we burns more nutrition, so our body becomes nutritionally deficient. The second thing that happens is that the body creates more waste. And this is what contributes to lymphatic congestion. And when we create more waste in the body can become toxic. Now, when you have these two things that occur and you have these imbalances, how does the body express that? It does it one way and one way only. Swelling. That's a good guess. That's a good guess. It does it through muscle contraction. Okay? Where are you going to experience that muscle contraction? Wherever the weakest link is in the body. It can be in your calf, it could be in your hip, it could be in your forearm, your jaw. It's definitely going to be in your spine. Absolutely. That's what causes the subluxations and the postural issues. And when we have subluxations, it leads to nerve interference and it decreases communication between your brain and your body. Now, when you have decreased communication between your brain and your body, your organs don't function properly, and your body is now existing in a weakened state. So when the body becomes malnourished, subluxated, and dysfunctional, it exists in that weakened state. And guess what? That's the perfect environment for disease to set up shop. Right? So my job, when people come in to see me, is that their body is existing in this weakened state. I examine them, take a history on them, figure out where their primary source of stress is, mechanical, emotional, nutritional, and then take them and get their body back into balance. That is my job. The second thing that my job is simply to educate them on how to take better care of themselves. Because everybody is different. I could have 10 people that walk in that have migraines or allergies or eczema, and there's 10 different causes. Because everybody is their own set of walking chemistry. Everybody has different stressors. Everybody perceives them differently. Everybody manages them differently, or shall I say, don't manage them. And I've been doing this for 22 years. And a big majority of people that come in to see me, their primary source of stress is emotional in nature. So there's a breathing release technique that I do that actually helps to release this emotional stress from my patient's subconscious. And it's very, very powerful and helps to get rid of it just like that. So when people come in to see me, I'm actually treating two different things. I'm going after the cause of their issue, but at the same time, I have to treat the physical manifestation of it. So I'm treating both things at the same time. Make sense? Seems pretty simple, right? All right, so common headaches. These are the 5 that I see in my practice. We're going to go through this now. Any questions on any of this? It may seem complicated to you, yes, but it doesn't matter when a patient of mine comes into my office with a headache. Doesn't matter what kind, any of these 5. Before they leave, I can get their headache at a minimum of 50% better, but more times than not, it's 100% gone before they leave. And I don't give them anything. I just simply work on their body and adjust them and get their structure back into balance. All right, migraines. I think everybody kind of knows what migraines are. Here's a list of symptoms that I found on, I think it was Mayo Clinic website. So migraines seem to be the most severe. So what does the Mayo Clinic say that the cause of the migraines are? Well, though migraines causes aren't fully understood, genetics and environmental factors appear to play a role. Changes in the brainstem and its interactions with trigeminal nerve and major pain pathway may be involved. Also, some chemical brain imbalances may occur with serotonin. So does this give you a lot of hope of what's actually causing it? Or does it sound like they just said a bunch of words that don't really mean anything? Yeah, exactly. It's very vague, right? Well, in my experience, most people that have migraines have a lot of refined sugar and carbohydrates in their diet. And when you have a lot of refined sugar and carbohydrates in your diet, it depletes your body of the alkaline minerals. The alkaline minerals are potassium, magnesium, sodium, to name a few. So with migraines, they're talking about the blood vessels in your head that constrict. And then they blow up and they dilate. That's what causes the aura that they have. So why would a blood vessel constrict and then dilate? Well, let's look at the anatomy of a blood vessel, the arteries. You have an outer layer of muscle, you've got an inner layer of muscle, and between the two is a big, thick mineral layer. Those minerals are there to help with the elasticity of it. So if you're eating a bunch of sugar and simple carbs and processed food, and you don't have any alkaline minerals, does the artery have the ability to keep its integrity? No. That is a source of migraines and what causes it. Poorly managed emotional stress, right? People get overwhelmed very easily. They don't know how to handle or manage their emotional stress, so they bottle it up. This weakens the digestion system, and leaky gut and toxicity ensues. Guess what? The liver gets clogged. There's not one person that I've seen with a headache that doesn't have either the liver or the spleen involved. More times than not, it is the liver. So when your liver is clogged up and you can't break this stuff down, right, then that causes the subluxations up there at the base of the skull, and that's what causes the migraines. So how do you fix this? Well, manage your stress better. Learn to be able to get that emotional stress out of you. And what I tell people about that with the emotional stress is that there's so many different things that you can do. You know, journaling can be part of that. Simply talking it out with either a trusted family member or friend, or nobody even has to be there. You can just simply give voice and speak it out loud. I had a patient come in that comes in with a sore throat. I'm like, okay, well, let's run through the horn, right? Anything mechanical? Did you trip or fall? Did you injure yourself? No. Anything nutritional? Did you change your diet up? No. So then it has to be emotional. Because she comes in regularly, she gets her adjustments. I have her on an enzyme protocol, so she's taking her supplements regularly. So I'm like, all right, your throat. What is your throat? Again, it's your voice. So I said to her, well, who are you supposed to be saying something to that you're not? Without hesitation, she's like, my boss. I'm like, okay, so this is what I want you to do. I want you to go home, and I want you to pretend that your boss is standing there right in front of you. And I want you to give voice and speak out loud what you need to say to him or her. And do not edit yourself. If you got to go off and yell, like, do that. Whatever you got to do, give a voice to it and get it out of your system. She went home and she did that, and almost when she was immediately done, her sore throat was gone. So there's lots of things that you can do to help manage the emotional component of that. Meditation is another good thing. Exercise. The one thing that us adults that we forget to do is learn to nurture our inner child. Give ourselves permission to play. Do something that's fun. What do you need to do to charge your battery? Right? Some people like to play an instrument. Some people like to play with their dog or their kids, right? Going for a walk, putting a puzzle together, getting together with friends. Like, do something that brings you joy. Could you imagine if you don't do anything that brings you joy and you're just kind of working day in and day out like a robot? You'd be a little depressed a little bit, wouldn't you? So do something that brings you joy. Clean up the diet. If we replace all those refined carbs with fruits and vegetables that actually had those minerals in them, do you think that that would help with the integrity of the artery and the migraines? Would it also help with the liver and helping to detox stuff from all the phytonutrients from the plants? Yes. Heal the gut and clean up the toxicity. Support the liver and get chiropractic adjustments to help restore communication between the brain and body. Tension headaches. All right, what does the Mayo Clinic have to say about tension headaches? Well, these are the symptoms of tension headaches, which are pretty simple. They're not as severe as the migraines. Those are the most severe. But what the Mayo Clinic says is the cause of these, the cause of tension headaches is not known. Like, really? Well, in my experience, oh, look at this. High refined carbohydrate intake, poorly managed emotional stress, weakened digestion system, liver gets clogged, subluxations. Wait, isn't that what happened with the migraines? Manage stress, clean up diet, heal gut, support liver, chiropractic adjustments. Seems to be a pattern running there. You think it could really be that simple? Say yes. Yeah, exactly. All right, sinus headaches. These are the symptoms of sinus headaches that Mayo Clinic says. And again, this is what they say is the cause of it. Sinus headaches are usually associated with migraines or other forms of headaches. Wait, so you're just describing it. That's not what's causing it. Sinus headaches are associated with pain and pressure in the face and sinuses and can cause nasal symptoms. I'm surprised they even had this on the website. Most of these headaches are not caused by sinus infections and generally should not be treated with antibiotics. What? They actually admit that? Like, holy smokes. Yeah. All right. So, what causes sinus headaches? Well, high refined carbohydrate intake, weakened digestion. There's a little bit of a difference in this one. Liver, spleen, and kidneys get clogged. And the other ones, the kidneys and the spleen may not be involved usually, but with the sinus headaches, you throw in the kidneys with this. Then you get lymphatic congestion. Because if you have leaky gut stuff going on and you've got high amounts of stress and your body becomes toxic, your liver, your spleen, your kidneys can't filter out those toxins. So then where's the overflow valve for all that toxicity? Right here, the sinuses. So this toxicity sits here. Then you walk outside and you breathe in whatever's in the air that day, or that pet dander or whatever, and it sticks to those toxins. And that causes the inflammatory response. That causes your seasonal allergies. So if these toxins weren't here to begin with, would you develop sinus issues? No, you would not. Right? The overflow valve is the sinuses. And again, subluxations in the upper cervical part and in the thoracic area. So clean up diet, heal the gut, support liver, spleen, and kidneys, clean up the lymphatic toxicity. There's a way that I can do that with supplements and enzymes to help burn up that toxicity in the body. And then chiropractic adjustments. All right, period headaches or hormonal headaches. Mayo Clinic didn't have anything to say on this, so I went to WebMD. Yeah, right? So these are the symptoms of women when they get hormonal headaches, which are all pretty common, right, for headache symptoms. So what do they say causes these? Well, they said birth control, perimenopausal, hormone replacement therapy, oophorectomy, which remove the ovaries, pregnancy, or after birth. So they listed a lot of these things, but basically what it comes down to is that it's a fluctuation of the hormones. It's either an increase and decrease in either of estrogen or other hormones during the cycle that causes the headaches. Again, they didn't say what actually causes that. They just say that, oh, your hormones fluctuate and you're going to have headaches as a result of that. Well, again, I call bullshit on that. Because there is a reason. You do have a hormonal balance. They're not wrong about that. Usually women will have poor diets when it comes to certain cravings and stuff with their cycle. So then when they overeat and overindulge in the bad food, it causes the digestion system to become out of balance and the liver becomes clogged. Now, the liver has to deal with hormonal balance. It has to detoxify and it has to get rid of excessive hormones in the body. So when the liver can't do its job appropriately, then these hormones have to stay in the body and they have to circulate. And that's what causes the hormonal balance. But if the liver, like the liver has so many different jobs, detoxification is one of the bigger ones. It also has to deal with, protein metabolism, fatty acid metabolism, carbohydrate metabolism, all that stuff. But when it can't clear out the excessive hormones, that's what causes the hormonal imbalance, and that's what causes the headaches. It's kind of like the same thing, like women that have hormonal headaches for their cycle is almost like the exact same mechanism when kids hit puberty and they get acne. All acne stuff is a liver issue because you have an influx of the hormones that bring in these, young boys and girls into adolescence and adulthood that their bodies don't know what to do with it. The other thing is that these kids eat a bunch of sugar and crap food. So again, it's going to clog up the liver, and if the liver can't do its job appropriately, where does it have to push those toxins out? Through the skin. There's your acne. So it's almost like the exact same mechanism and pathway in the body for women that have hormonal headaches versus kids that have acne. There's an adrenal imbalance in this. Now, your adrenals are part of the hormonal balance in the body, and they are like at the top of the pyramid. So if your adrenal glands are out of balance, then that's going to affect the sex organs. So the adrenal gland makes a lot of precursor hormones for the sex organs. So if your adrenals are burnt out and you can't make the hormones in the sex organs, that's also contributing to the hormonal imbalance. And then subluxation is more in the thoracic spine, but also in the lumbar spine and not the upper cervical spine. So again, clean up diet, heal gut and toxicity, support liver and adrenals, and get chiropractic adjustments. Almost like there's a pattern there. All right, so this is one I kind of came up with on my own that I've seen, is that people get like these toxic headaches that don't necessarily fit in any of the other 4 categories. And the best way I can describe it is like it feels like you have a hangover, but you didn't drink anything, right? So usually with this, it's usually emotionally overwhelmed. People get very, very emotionally overwhelmed with things, and they're trying to hold like 20 different thoughts in their head. And they're just stressing themselves out. Also, high refined carbohydrate intake. It's almost if people actually ate fruits and vegetables, they'd get rid of their headaches. Could it really be that simple? Try it and find out. You let me know. Weakened digestion. Liver, spleen, kidneys get clogged. Lymphatic congestion with this one as well. Subluxations in the upper cervical and thoracic spine. Clean up diet, heal gut and toxicity, support organs, clean up lymphatic toxicity, and get adjusted to restore brain-body communication. All right. So there's a cause and effect relationship that occurs. It doesn't matter. This talk could be on allergies. It could be on eczema. It could be on psoriasis, fibromyalgia. It doesn't matter what you call things. The medical community does a really good job of making up names so that they can sell drugs for those names, right? I don't really care what the condition is. I don't chase symptoms around the body. I know what normal looks like. I know how to measure it. I know how to measure deviations from normal, and I know how to monitor progress. That's what I do in my practice, and this is why I get the results that I do. So there is a sequencing that has to occur. So we get sick in a certain way So if there's a recipe for our bodies to get sick because we abuse it mechanically, emotionally, and nutritionally, then there has to be a sequence or a recipe for the body to get well. And this is what it looks like. First of all, it's the poorly managed stress. If you don't find out where that primary source of stress is, if you do not minimize or manage it better, you are not going to heal. Period. End of story. Okay? Because with that stress being there, it's like you're in a car, you're going 100 miles an hour, and it's on cruise control. Your body is going way too fast. It doesn't have the ability to slow down. And when you're going 100 miles an hour and on cruise control, your body is burning nutrition like a forest fire with a 100-mile-an-hour tailwind. You literally cannot keep up with that. You cannot put food in your mouth fast enough to keep up with that. So the first thing that you have to do for your body to heal is you got to take your foot off of that gas. You got to slow it down. And my mentor, Dr. Loomis, he's like, I'm not saying can't listen to rock and roll. Let's just turn the volume down some to give your body a fighting chance so that it can do its job. Poor diet. The body becomes toxic, creates subluxations, and the organs are malnourished. That leads to any health challenge. So how do you get well? Well, you got to identify that source of stress, minimize or eliminate it the best that you can. Chiropractic care to restore brain-body communication. Let's nourish the body by cleaning it up and actually eating food that have nutrients in it. Clean up the gut and nourish the organs. There are specific enzyme supplements that I use to support and nourish anything, any organ in the body. So that's how you get people well. Now, let me say the same thing, only different. So we start off, right, 100% function, right, with innate intelligence. But what happens is that we abuse our bodies mechanically, emotionally, nutritionally, that brings our function down. Now, let's just say, I just pick an arbitrary number. Let's just say, 40 to 60%. So you have this threshold here. So below is 40, above it is 60. So when your body gets weak enough because of the stress and it goes below this line, guess what? You become symptomatic. Once you become symptomatic, like, all right, headache. What do most people do to take care of their headache? Advil, right? Tylenol. So they'll take an NSAID, and then they may go up above the line a little bit and become asymptomatic. But their body still is existing in a weakened state. Then guess what? The next trigger that comes along, oh, guess what? They become symptomatic again. They get another headache. Take another Advil. Then they come back up here. And you see how they just fluctuate above and across this threshold their whole life. They never actually get back up to 100%. All right, let's just take allergies, right? Oh, here comes springtime. Your body is stressed, okay? Pollen starts to bloom. You become symptomatic with allergies. What do most people do? Let's take Claritin, Zyrtec, right? Decongestant. All right, symptoms are gone, but nothing has changed in the body. So the next time you walk outside, boom, you become symptomatic again. So you're existing in this weakened state. Wouldn't you like to get back up to 100%? Well, how do you do that? You do that through healthy habits. You do that through helping to strengthen the body and restore normal function. That's what I do. That's what I educate my patients on how to better take care of themselves. So, do you want to be rich or just not poor? Do you want to be healthy or just not sick? Right? There's a big gap between being sick and or not being sick and being healthy. And it all starts with your mindset and what you think and believe and the daily habits that you do. Because both health and disease need to be built in the body. And if you're not actively engaged in healthy habits to strengthen the body, you're actively engaged in creating disease by default. Make sense? All right, got a couple testimonials to go over here. All right, so Patricia, that's not her real name, but Patricia is a 53-year-old female that comes in to see me. She has 2 to 4 migraines a month, and each migraine lingers for 2 days. They wake her up at 3 or 4 o'clock in the morning, always. 3 or 4 o'clock, acupuncture. What organ is that?
1 to 3 is liver, but if you wake up at 3 o'clock, it's
Yeah.
overstressed.
Yeah, exactly. Interesting, huh? All right. She vomits, she sweats profusely, and she has diarrhea. Feels like her head is going to explode, is what she said. She had her gallbladder out decades ago. And gallbladder is responsible for what? Fat digestion, right? So we know she has a digestion issue for decades. She has 6 to 10 loose bowel movements a day. And she has these vomiting fits that she calls. So when the migraine wakes her up, she starts to sweat, she starts to vomit, but she proceeds to vomit for the next 2 to 3 hours until everything is out of her. This has been going on since the 80s. She's been to 1 chiropractor and has 2 adjustments in her entire life. So she's basically been getting passed around from neurologist to neurologist to neurologist. And she has medications that don't really work anymore for her. And her diet is poor. So, what do? I examine her, I do a history on her, start getting her adjusted, and we start working really hard in cleaning up her diet and giving her enzymes to help her gut heal, to help clean out her liver, and to get her gut back into balance and her liver back into balance. Also give her some posture exercises to do, stretches, strength exercises. Enzyme nutrition to help with the digestion, liver, kidney, and the nervous system, to kind of help calm her nervous system down with those alkaline minerals I was talking about. First month of care. Migraines are less intense. Vomiting fits down to twice this month. And she's down to 1 to 2 bowel movements a day from 6 to 10. First 4 weeks. Second month of care, she had 1 mild headache. No migraines. 1 vomiting fit. 80% better overall in 2 months of care. She's more energy, stronger digestion, more active, and is taking less medication. She is very surprised at how well she's doing after 2 months. What do you think is going to happen if you actually restore normal function, right? I just feel so bad for her that she had to deal with this for so long. Nobody ever told her, hey, maybe you need to get adjusted regularly, you know? All right, Robin. Robin's an 18-year-old female that she's had migraines for 5 years. When she came in to see me, she's had a migraine every day for the last 30 days. She's in high school, right? It's her senior year. She's going to college. She is putting an enormous amount of stress upon herself because she wants to do well. That was her primary source of stress, was emotional. Never been to a chiropractor before. Never had her gut looked at. So I taught her how to meditate and journal and not be so hard on herself. Like, calm down. Everything's going to be okay, right? Just had to help coach her through it a little bit. Started getting her adjusted. Gave her some strengthening exercises for posture. Gave her some enzyme nutrition for her gut, liver, kidneys, and nervous system. And her results, first month of care, no migraines, 3 mild tension headaches, 90% improvement. Second month of care, no headache of any kind. Pretty cool, huh? Amy, we're not going to talk about Amy. It's just another thing, another testimonial. I think you guys get the point. All right, so to kind of summarize everything here, we talked about innate intelligence, 100% function, and the body's ability to express health. We talked about stress. Stress is the cause of all disease. Men are the cause of all stress. Stress causes dysfunction, and when the body becomes weakened, it doesn't have a choice. It has to express symptoms, and it has to give you a disease process. Call it whatever you want. I don't really care. But if you were actually to strengthen normal function, and this is what I do. See, most people wait for a crisis to happen before they react. This is what I call defensive health, right? You're doing something after the fact. Well, there's this whole other game over here called offensive health, where if you actually were proactive, engaged in healthy habits, learned how to strengthen the body and go on the offense, do you think you'd have to play defense ever again? No. I'm not saying you're going to be perfect and never experience any illness or ailment ever again, but it's going to greatly reduce your risk because let's face it, we're human. We make mistakes. Life happens to us. It's not what happens to us that matters, but it's how we handle it. That's what's more important. So when you restore normal function by restoring homeostasis, how do you restore homeostasis? Well, you have to take your foot off that gas pedal. You gotta manage the stress better, period. Got to get chiropractic care to reestablish that brain-body communication. And you have to nourish the organs. By doing those things, we don't need to outsmart the body. The body knows exactly what to do. We just need to give it the right support so that it can do its job. When you talk about chiropractic, all right, I throw the word chiropractic in it. What first thing that pops in your head? What do chiropractors do? Alignment. Okay. What treatments? What do they treat? Yes. Correct. What? Skeletal system, exactly. But in society, chiropractors are known for what? Neck and back doctors. Neck pain, back pain. But going to a chiropractor for neck and back pain is very limiting on what we can actually do. It's like getting a new smartphone and only using it for the calculator. You can use the calculator and you can compute the shit out of that and get great results. But is that what a smartphone was designed for? No. Chiropractic was not originally designed for just neck and back pain. D.D. Palmer, back in 1895, when he first came up with this and put this all together, was treating organ-related issues and other things, not just neck and back pain. It wasn't until the 70s and the 80s came along that the chiropractic profession sold its soul to the devil and wanted to become part of the insurance company. So then the insurance company is like, hey, you guys are musculoskeletal doctors and you are neck and back pain doctors. And we've never been able to get out of that box. But it's very, very limiting on what we actually do. So chiropractic care, in essence, is first and foremost about brain health. It's about nervous system balance. Because when your brain is functioning properly and your nervous system is balanced, guess what? Your hormones are balanced, your organs are functioning properly, and your immunity is strong. So when you have subluxations and your body is weakened, your hormones become out of balance, your organs don't function properly, and you have weakened immunity. It really is that simple. So I'm trying to rephrase or reconfigure the conversation around chiropractic care. Chiropractic care is not neck and back pain. Chiropractic care is brain balance, nervous system balance, whole body balance. That's what it was designed for. Okay? And there's just some examples of what chiropractic can actually do. So, the elimination of headaches, right? Chiropractic care, strengthen posture. Take care of your emotional health. Okay? There's lots of things that you can do that we've talked about. Clean up the diet and get the right supplements in the body to support the organs to get them back into balance. And then create healthy habits, right? There's lots of different things that you can do to help create these healthy habits. Chiropractic, yoga is fantastic, okay? Because it works on strength training, it works on flexibility, and it works on posture, all at the same time. And you have to be present in order to get a good yoga practice. So it works on your mental aspect of it as well. You ever try to go and do yoga and you're just not present? Yeah, why'd you even go? You know? So there's lots of different things that we can do to develop those habits.